Good evening, and thank you for joining us. As the world is faced with a pandemic, we are navigating uncharted and unprecedented times. As a community, we are here to support one another, provide accurate information, and ensure we are standing side by side to truly demonstrate that together we are as relentless as migraine. Tonight, we are honored to host this Facebook Live event on COVID-19, where we'll hear from the chair of the American Migraine Foundation, Dr. Dodick, and the president of the American Headache Society, Dr. Kathleen Digre. Dr. Dodick is a professor of neurology at the Mayo Clinic College of Medicine and a consultant in neurology at the Mayo Clinic in Scottsdale, Arizona, as well as the director of the headache program at the Sports Neurology and Concussion Program at Mayo Clinic in Arizona. Dr. Dodick is also the past president of the American Headache Society, past president of the International Headache Society, chair of the International Headache Society's Global Patient Advocacy Coalition, and chair of the American Brain Foundation. Dr. Kathleen Digre is the Distinguished Professor of Neurology and Professor of Ophthalmology at the University of Utah. She is the current president of the American Headache Society and the past president of the North American Neuro-Ophthalmology Society. As a reminder, tonight's discussion is meant to support the community in the questions they may have in understanding COVID-19 and its impact, if any, to patients living with migraine. It is not meant to replace or take the place of the advice given to you by your healthcare provider. The American Migraine Foundation encourages you to discuss any personal concerns or questions about your treatment plan with your healthcare provider. We will take questions after the talk, but please feel free to submit your questions in advance as you think of them. Dr. Dodick, can you give our community an overview of what we know so far about COVID-19?
Thank you, Nim. And I want to thank everybody for tuning in, and I truly hope that you are staying healthy and staying safe. Clearly, we are living through an unprecedented and historic crisis that has and will continue to impact all of our lives for some time to come. With regard to the delivery of healthcare and our ability to care for patients, I have been just so impressed by healthcare workers at every level in their response to this crisis in general. And because I've seen it up close, the response among my colleagues around the country to the care of our patients with migraine and cluster and other disabling headache disorders in particular. Institutions and providers are flexing their creative muscle in an attempt to ensure that there is minimal disruption to the care of patients while protecting patients themselves and their colleagues. So this novel coronavirus has now been reported in 192 countries around the world and in all 50 states around this country. And much of the public health focus has been on so-called flattening the curve, which simply means slowing the spread of the virus. In other words, slowing the transmission from person to person. And the reason, of course, that's so important is there are a number of reasons. One, it's to prevent the healthcare system from being overwhelmed and to enable the healthcare system to be able to care properly for patients with severe infections, especially those that require breathing support with a respiratory device or a ventilator. Secondly, across the country and at leading healthcare institutions, as well as the National Institutes of Health, clinical trials are underway to evaluate the effectiveness and the safety of a variety of drugs, most of which have been on the market for years to treat other diseases, and are now being what we call repurposed to determine whether they are able to treat this virus. So if we can spread the infection out longer and flatten the curve, there will be time, we will be buying time for those therapeutics to become proven to be effective and safe and become available. I think another reason we want to flatten the curve or slow the spread of the virus is the development of what we call herd immunity, which is really community immunity, which occurs when a high percentage of the community is immune to a disease, either through vaccination, which is not possible yet for this disease, or in the case of this disease, from prior illness. And there's an intense effort underway to develop tests to determine who actually has immunity, especially among workers in general and amongst healthcare workers in particular, since there's less of a risk for those individuals to be re-exposed, and they can be on the front lines with lesser concern compared to someone who doesn't have immunity. And then ultimately, the development of a vaccine. We need time to develop a vaccine. And as I'm sure most of you are aware, this is a more time-consuming process than even studying currently available therapeutics to determine whether they're going to be effective. And that will take the better part of a year or more before a vaccine is available. So, I mean, to flatten the curve and to minimize the spread, it's important to know, I think, how the virus is actually spread, and to follow the CDC guidelines regarding physical distancing. Many of you have probably heard of social distancing, and now the preferred term is physical distancing, since the last thing we want to do is become socially isolated. And so there are a variety of ways in which this virus is transmitted that you should know about. The first of which is droplets. When an infected person coughs or sneezes, droplets with the virus contained in little droplets will fly out and could potentially be breathed in or land on other mucous membranes like the eyes and infect those who are within a certain distance. And that's why you hear about the physical distancing of 6 feet as being so important. There's also a possibility of airborne transmission, and there's very good research showing that the virus can stay alive in the air for up to 3 hours. And so I think that's important to recognize as well. And then, of course, surface transmission. So when you touch an infected item, such as stainless steel or plastic or cardboard or door handles or light switches, where the virus can actually survive for hours to days, then you could transmit that to yourself in that way. And so that's why it's so important to constantly be washing your hands and sterilizing and disinfecting surfaces that you frequently touch. So all of these reasons is why the American Migraine Foundation and the American Headache Society issued a memo for our patient community designed to protect both the patient and the healthcare provider during these crises. And you'll see that on our website. But essentially what we're recommending for at least the next 8 weeks is that all non-emergent procedures be deferred, all new face-to-face consultations wherever possible be deferred. And we'll talk a little bit more about that later. And then all face-to-face follow-up visits be deferred. And again, there's a lot of creativity now in terms of how to conduct those visits virtually or by telephone. And we'll get to that a little bit later, I'm sure. So I just wanted to provide that as a bit of a backdrop of where I think we are right now with COVID-19, and just things you should know about how this is transmitted and how to best protect yourselves.
Thank you so much, Dr. Dodick. You know, you really mentioned two key things amongst many important things, which is the physical distancing and flattening the curve. And I'm sure many individuals listening tonight have heard that a lot, but I think it's really important we remind our community about how really important that is moving forward, especially in the next 8 weeks or so. So we have a great discussion ahead of us tonight, and I'll be asking both you and Dr. Digre to share some information about various topics that are more specific to the migraine community. Dr. Digre, what risk do you think migraine patients have with COVID-19 and exposure to COVID-19?
Well, I think every patient has a risk to get COVID-19, but people with migraine aren't at greater risk. They're the same risk as the rest of the world, depending on certain comorbidities. But I do think that people with migraine will have some individual risks, like how do you tell that the headache is related to COVID-19 or is it part of my migraine? And I think it's going to be important for people to look at a headache and say, is this similar to the headaches I've had before? Is this similar to my previous migraine? I think that's something that is going to be important, because headache occurs about 5 to 10% of patients with COVID-19 virus. The second challenge, I think, for patients with migraine is going to be access to care. we have been living in a time when we can go to urgent care, we can go to infusion centers, we can go and get care when we need it. Care is not going to be as readily available as it's been. Not only is the healthcare system really stressed and stretched at this point, our providers are also stretched, and many institutions are stretched to provide that kind of care. Plus, we don't want our patients with migraine to be going to public places to get types of care, because that will increase the exposure risk. So I think those are some of the challenges that individuals with migraine are going to face in this epidemic.
Thank you so much, Dr. Digre. Dr. Dodick, Dr. Digre mentioned comorbidities. What comorbidities should the migraine patient community be thinking about as COVID-19 is becoming increasingly more of a concern?
So, I think people need to be thinking about both comorbid, in other words, diseases that occur more commonly with migraine, as well as coexistent illnesses that have nothing to do with migraine, but they just happen to have that disease. So as people have been hearing about chronic medical conditions, make certain patients more vulnerable to this infection and more vulnerable to the virulence or the severity of the infection that they get. So a number of diseases stand out. Chronic respiratory diseases are one thing in particular, but diabetes, hypertension, cardiovascular disease, chronic kidney disease, and interestingly enough, obesity. And for reasons that are not clear, obesity seems to confer an increased risk of more severe infection. So these are the types of comorbid and coexistent diseases that people really need to be mindful about, and therefore keep that physical distance and follow all those CDC precautions, because they are more vulnerable to potentially a more severe infection.
And then I'd like to add age, as the older individuals over 60 seem to be at a little higher risk as well.
Yeah, absolutely.
And so is it correct to say, Dr. Digre and Dr. Dodick, that someone with chronic migraine or episodic migraine or even hemiplegic migraine without coexisting or comorbid conditions don't have to worry about the severity of the virulence of COVID-19? Or, is it?
Well, I'll tell you, I think it's very individualistic, and even very healthy people can get a virulent course. So at this point, I don't think we can predict, but I would say migraine does not give you a risk factor for developing COVID-19.
Thank you.
Yeah, I just want to echo what Dr. Digre said, and that is that just because you happen to be 40 years old or 35 years old with no comorbid or coexisting chronic diseases doesn't mean that you can't contract a very severe form of this disease or, be gravely ill with this disease. Those are just certain diseases that increase the risk of, a worse outcome. And what we didn't talk about, of course, are those people who happen to be on immunosuppressive drugs, like chronic steroids or chemotherapy or other immunosuppressive drugs for other diseases like multiple sclerosis or rheumatoid arthritis, those sorts of diseases. So if you're immunocompromised for any reason, I think those people are at increased risk of a more severe disease course as well.
Thank you for that added detail. That's very helpful. Dr. Digre, what tips and tricks do you have for patients who are now for the first time utilizing technology to visit with their provider or to have teleconferences with their provider during this time of pandemic?
Well, everybody's going to have a different interface with technology. Immigrants like I am to technology, it's a little bit more difficult to use some of the new technology, but younger people who are very comfortable with it are going to be able to just slide right into virtual visits. So I think individual comfort is going to be a first sort of hurdle for some people, but I would urge everybody, and I'm just going to tell you, my 96-year-old mother is on iPad and Zooming with our family. And at this time, I think we need to become tech savvy. We're just going to have to, if we aren't, we're going to have to do it. And I would urge everybody to learn a little bit of technology to be able to do that. Because many of the visits that we're going to be having over the next months, if this thing goes on for a long period of time, will be virtual. And your provider will want to be able to have a virtual visit with you. So I do think that there's going to be this, the trick is going to be individuals becoming tech savvy. And then institutions. I think that's another piece of this, that institutions are going to be learning technology and doing things that they've never done before. Many institutions never used teleneurology or teleheadache or anything like that, and that they're going to be working to try to do this as well. And I think each center, each place, each provider is going to have to find what his and her comfort is in doing these kinds of visits. So it's going to be a learning curve for us all. I think all of us are going to be learning some new ways to do things.
Absolutely. And Dr. Dodick, how about you? What are you encouraging patients to do to be prepared for these new virtual visits?
Well, it's incredible to me how quickly institutions and practices are developing the technological capacity to provide these virtual telemedical visits. But it's also surprising to me how savvy patients actually are, or they're bringing themselves up to speed very quickly with this because of the need and because of the necessity. So it's in their best interest, of course, not to be getting on a plane or not to be getting on a train or not to be coming to these facilities, especially over the next 8 weeks or so. And so I agree with Dr. Digre to the extent that they can get themselves brought up to speed quickly with whatever technology their provider is using, I think is important. One thing I might recommend is not that you necessarily want your children or your grandchildren necessarily coming into your home, particularly if you're elderly, but getting on the phone with them and having them walk you through it, which I do with my kids. When I don't understand something like tonight, they help me a great deal. So there's always people around who are more tech savvy, certainly than me, who help me. But I think until this is fully up to speed, many providers are doing telephone visits. I just did my fourth telephone visit this afternoon. Now, these are with established patients who I already know, but these are very helpful for those patients who shouldn't be leaving their home and who I can provide ongoing and follow-up care, and I can adapt and I can change their treatments based on how they're doing. So it's as good as, unless they have a new complaint, it's as good as actually sometimes being face-to-face. I will say that the other thing I've been very reassured by is that licensing authorities and indeed state governments are making it possible for physicians like us to provide care remotely to patients who may live in another state without requiring them to be licensed in that state. I can tell you from having done telemedicine now for quite some time in the stroke area, I used to have to be licensed in every single state in which I would see a patient remotely. That's one way in which we've adapted very quickly to allow, me here in Arizona to provide care to someone in Nebraska without actually being licensed in Nebraska. So that's really one thing I've been very happy to see states and governments and reimbursement authorities adapt to.
That is great news to hear. And so I'm a patient with migraine, and I'm very new to the telehealth world and visiting doctors virtually. Is there anything that you would tell me as a patient to come to these visits and be prepared to discuss, knowing that it's not the same as an in-person visit?
Yes, I think that patients have to be more prepared. I would urge everyone to write down questions ahead of time, and especially have your medication list with doses. I did a telephone call on my follow-up patients as well, and one of the most time-consuming pieces was just trying to figure out what medications the person was on. And I think that's critical, because we can't make a change in medicine if we don't know exactly what a person's on for the migraine prevention, acute migraine, but also other medications for other illnesses or conditions, vitamins, herbs, and all of that. Just have a list all done. And then I think knowing in advance the questions least I'm going to ask will be, how many days have you had migraine? How many days have those been so severe you couldn't do your normal activities? How many headache-free days, totally headache-free days are you having? You know, is the acute therapy working well? If not, what part of it isn't working well? Is the preventive therapy working? And are you having any side effects? And those are the questions that we're going to be asking every single patient. And if the more you can be prepared for that visit, the better it will be for you, but also for your provider to give you the best treatment possible.
Thank you.
Yeah, I would agree with everything Dr. Digre said, and I don't have too much to add other than to say patients may remember what I like to call the 3 F's. F is for frequency. The frequency and the number of headache days, or the frequency of headache days in a given month. The other F is for functional impairment. On how many of those days is their function impaired? And then the other question I like to know, which is the third F, is the frequency with which they're taking acute medicines. And then, as Dr. Digre said, what acute treatments are they taking? What preventive treatments are they taking? How are they working? And then what other medications? So it really boils down into the 3 F's on one bucket, and then medication discussion in the other bucket.
So be ready, be prepared, and know your 3 F's is a really big takeaway from this topic. And now that we're talking about medication and medication supply and acute and preventive treatments, you know, Dr. Dodick, are providers and public health officials all on the same page about the 90-day supply and patients getting their prescriptions in bulk, knowing where we are with the pandemic?
Well, I don't know. It's obviously quite variable, but and some insurance carriers won't allow or don't allow historically their patients to have necessarily a 90-day supply of certain medications. But times are different, and we're in a crisis right now. And I think it's critical that patients not leave their home more often than is absolutely necessary. And so if that means having a 90-day supply of a prescription that keeps them out of the pharmacy, having to go back to the pharmacy every month, then that's what is needed. And so it's up to the patients to advocate for themselves, and it's up to the providers to advocate in addition for their patients, because we're living in a completely different world right now. And so some of these hard and fast rules need to go by the wayside when it's in the interest of public safety and patient safety. So to the extent that I can, I always try to give my patient a 90-day supply of the medication. And when that's not possible, or even when it is, when patients are picking up their prescription, I try to make sure that either it's a mail order pharmacy where it's delivered to their home, or it's a drive-through pharmacy, because it's better to drive through rather than having to get out of your car, go into the pharmacy, and be exposed to others who may be infected. So those just some tips. If you do have to go to the pharmacy, try to pick a drive-through pharmacy. And if you can get a 90-day supply, then definitely do that. And if not, speak to your insurance provider. And if you need your provider to speak to them as well, then don't hesitate to do that.
Dr. Digre, do you agree with that 90-day supply as well? And are you encouraging patients to advocate?
Absolutely. And then providers will advocate for you. I mean, every day I'm advocating for my patients. And in this situation, I would hope that they would loosen some of these restrictive rules.
Great. So again, on the topic of medication, we also know that there's several rescues that we use at home when we're experiencing a migraine attack. And under normal circumstances, we may be using them and being compliant, but now in a pandemic, many patients are a little bit confused about when to go see an urgent care or an emergency room and what abortives they should be taking at home. Dr. Dodick, can you speak a little about that, about when it absolutely is necessary during a pandemic to go to an ER or an urgent care, and if not, what a patient should be doing at home to manage?
Never before has it become more important to keep patients at home and to give them not just an acute treatment, but a second-line treatment and a rescue treatment. They need backups at home that they can administer, even if it's not an oral medication, in particular when it's not an oral medication, because some of my patients have other formulations that will keep them at home and keep them out of an emergency department or an urgent care. And I don't want to be too prescriptive here, but there are over 40 medications that we can provide people at home to use as second line backup as well as rescue treatments. And sometimes that requires an intramuscular or a subcutaneous injection, and either they can provide themselves, or that perhaps their spouse or child who lives at home could provide for them. So, but I think patients need to speak to their provider about a first-line acute treatment, a second-line acute treatment. Sometimes patients do better when they take a combination of treatments at once, than taking a single medication and then taking another single medication. But definitely they need a first-line treatment plan, a backup plan, and then a rescue plan. And I would say never before has it become more important to treat while pain intensity is mild. Don't wait for the attack to escalate. Never before is it, because outcomes are better when you treat early, especially when the pain is mild. So I know at this time people are thinking, well, I need to hoard my medications, or I need to save my medications because I don't want to run out of them and I don't want to have to go back to the pharmacy. But by the same token, you don't want to be in a situation where you start using all of your medication up because you've waited too long. So it's important to treat early and have a first line, second line, and a backup rescue plan.
Dr. Digre, how are you guiding your more chronic patients?
Exactly the same way. Acute treatment, a second plan, rescue. And then if medication fails, I mean, if all the medicines are failed, anything that a patient can do to go to sleep. Sleep often will be restorative and sometimes can get a person out of a bad migraine. The other thing is I like other formulations, whether it's injection. I sometimes even give suppositories, especially antiemetics. Some of them make people sleepy as well, which is great. And so I'd say these days we need plan A, which is your normal plan, plan B, which is your backup plan, and plan C, which is your, final get to sleep, stop nausea and sleep plan at the very end. And I think we really don't want people going to urgent care or ER at all. I mean, unless, it's a dire necessity.
And just to add to what Dr. Digre said, for those patients in whom nausea is an early symptom or a prominent symptom, or it becomes severe invariably with each attack, getting an antiemetic in quickly, either whether by the oral route or even better by a suppository route, is absolutely essential, because once patients get into this cycle of pain escalating, nausea, repeated vomiting, dehydration, then they're left with no choice but to have to come into an emergency department. And of course, that's where the exposure couldn't be greater. Not only the exposure that they will acquire or contract the virus, but that potentially they may be unknowingly transmitting it to a very sick and vulnerable patient in the hospital. So it's imperative that we do everything we can to keep patients out of the emergency department.
That's very good.
I would just add one more thing, and that is never before is it more important to practice good habits of eating well every day, sleeping well every night, and then stress reduction. I know we can talk about that in a little bit, but sleep is really critical. It boosts our immune system, and it's also good at preventing people from getting more headaches and migraine.
Those are all really helpful points, and we're talking a lot about avoiding visiting sites and facilities unnecessarily. And so I want to ask you both that, many of our patients in our community are relying on various procedures to combat migraine, for example, nerve blocks, etc. And so I wanted to know how you're guiding your patients on what to do with those procedures that may have been pre-scheduled. And Dr. Dodick, I'll ask you first, and Dr. Digre, if you can weigh in as well.
Yeah, it's a great question. Many of our patients rely on these procedures. It's exactly what keeps them out of emergency departments and keeps them comfortable. Some institutions have sort of canceled or deferred all non-emergency procedures under sometimes which these procedures fall. Even though they're urgent, for individual patients. I would say that if it's absolutely necessary for there to be a procedure, and for some patients it will be, then certain precautions need to be taken. And what are those precautions? Well, personal protective equipment needs to be worn by the provider. So a face shield, a mask, proper gown, even a hairnet, and if at all possible, the same PPE for the patient. I mean, if in an ideal world, assuming we can keep these procedures down to a minimum, then both the patient and the provider need to be protected and need to be doing this under the best possible conditions. So if these are done, then for the patient's sake and for the provider's sake, they can be done under conditions where both are protected. But by and large, if a patient can get by, or if therapy can be adjusted, new preventive treatments implemented for a period of time that gets a patient through until such time as the dust settles, we come out on the other end of this, and life gets back to normal and patients are able to come back for their routine procedures. Sometimes that happens too, and I've done this even over the last 48 hours with a couple of my patients where they can't come in for a procedure, and so we've adjusted their preventive treatment in an effort to keep them comfortable and buy time, if you will. I will also say that if a patient is coming in for a procedure, if he or she has any symptoms at all, fever, cough, shortness of breath, myalgias, if they're flu-like at all, they really should not be coming in and working with their provider to find an alternative treatment solution for them.
Dr. Digre?
I echo all the comments that Dr. Dodick said, and I would just say that every center is different. There are many centers that are allowing procedures to occur. Some centers are not. There's no right and wrong here. It really just depends on the center, the provider, and what's available.
Dr. Dodick, are there any risks to the patient in delaying their procedures?
Well, the risk, of course, is that their migraine or cluster or whatever they're getting their injections for will simply spiral out of control. And for some patients, they've been through and tried all these other preventive treatments, and they finally found a treatment paradigm that may involve injections that keeps their disease at bay and keeps them functional. And so if they're not able to get those procedures, then they will spiral out of control. And the very thing that Dr. Digre and I talked about, which is keeping them out of the emergency department, will end up being what happens. So for selected patients where it's absolutely necessary, again, let's try to do it under the right circumstances where both the patient and the provider are protected with personal protective equipment. And I know there are issues around that with regard to both regional and local and national shortages, but to the extent that it's possible, and patients should inquire about that. Will a mask be available to me? Will gloves be available to me? What is available to the provider to protect me? Because some of the procedures we do, as you know, can actually induce a sneeze. Sometimes when you do these injections, patients sneeze. It's a reflex. They can't help but doing that. And so if they had a mask on, and if the provider had a mask on and other protective equipment, it would reduce the risk of viral transmission.
Thank you so much. You know, you talk about spiraling and some of the stress that may come with delaying or not being able to have access to regular procedures. In a time like a pandemic and in uncertain times that we're navigating right now, we know that stress and anxiety are triggers for migraine attack. What do you recommend, Dr. Digre and Dr. Dodick, for our patients to do at home to help maintain what little control they do have over the situation? Dr. Digre?
Well, I'm going to start with, while we are physically distant, we shouldn't be emotionally distant from our loved ones, our friends, our family. We need to be connected. And that's why telephone, Zoom, FaceTime, all these different platforms that we've got we need to use them and stay emotionally connected to people, because being alone or and physically distant doesn't mean we have to be emotionally or socially distant. The other thing I think is, as I said before, never before has it been more important for us to be thinking about prevention for ourselves, sleeping well every night, doing some kind of stress release, whether it's reading a book, keeping a diary, meditation, mindfulness, doing something for yourself every day. Do something meaningful that gives your life meaning every day. And then I think a little exercise. If you can get out for a walk, you know, around your block or your home, just to get outside, get fresh air, we need to do that as well. And then practice de-stressing. And I know that the American Migraine Foundation is going to be having several wonderful things that Dr. Dodick will tell us about, and Nim will tell us about coming up. And take advantage of these. These are wellness moments that you can bring to yourself. And I don't think I can stress this enough, that stress is a trigger for migraine, and learning ways to cope with it is critical. But staying connected with each other, I think, is extremely important.
Absolutely. And, you know, AMF has that community already. We're so fortunate that we've already had this existing community, and we're relying on each other more now than ever. And I know as practitioners, this is often a conversation you have before a pandemic, you know, stress release and mindfulness. And so this is conversation that shouldn't be new to us as patients. But Dr. Dodick, I would love to hear what else you're emphasizing during a time that's so uncertain.
Well, I think Dr. Digre really covered it beautifully. I mean, a lot of our patients also do biofeedback assisted relaxation therapy and cognitive behavioral therapy. And I would encourage patients to, you know, look up certain biofeedback techniques and cognitive behavioral techniques for my patients who have gotten exposure to those in the past. Never before is it more important to be vigilant and compliant and you know, practice those on a daily basis. Breathing techniques, breathing exercises. It's one thing that we do routinely. So one of the biofeedback techniques that we use most commonly is a breathing biofeedback technique. And there are a lot of different breathing exercises, and I'd encourage patients to look those up. Exercise, you know, exercise has been shown in more than one study to be almost as effective a preventive treatment as medication itself, as some of our best medications. So for some patients, unfortunately, exercise can be a trigger, but for those in whom it's not, exercise absolutely can be really helpful. And if you have equipment indoors, or if you can get outdoors and go for a walk, I would agree with Dr. Digre there. The American Migraine Foundation will be having and focusing on this actually with an upcoming series of wellness events that will talk about mindfulness meditation, biofeedback, and some of the other things that Dr. Digre talked about. So I would encourage you all to watch the website and watch those segments when they come to you. And finally, I would say, you know, we put out a letter, probably about 3 or 4 days ago, and I would encourage you to go on to the American Migraine Foundation website, because we've included links from the CDC, from the World Health Organization, from the World Economic Forum, and I myself I really enjoyed those reads. I found them very helpful, and I think there's just some fantastic tips there on how to manage stress and anxiety during this difficult time.
Thank you both. We do have questions that were submitted from the patient community, and so I'd love to offer that up to both of you so we can get some question and answers out to the community as well. Does using a humidifier help, or is it harmful, especially if one were to become infected?
So that's a difficult question, because we have no idea with this COVID-19. We use humidifiers all the time for other reasons. The Colorado Children's Hospital did have an article about using humidifiers that steam may be better than cold humidifiers or or these ultrasonic ones, because they can spew particles into the air and could be more dangerous. So we really don't know the answer to that question. But if you need a humidifier, I think using a steam humidifier might be the way to go.
Thank you, Dr. Digre. Also, another question that came in, does the CGRP medication class lower the immune system?
No. And that's a great question, because a lot of monoclonal antibodies, biologics, if you will, that are used for other diseases like multiple sclerosis and rheumatoid arthritis, the kinds of drugs I was talking about earlier, are completely different than the CGRP antibodies. These antibodies have been genetically engineered and modified, if you will, in a way that prevents them from actually suppressing the immune system. So their target isn't the immune system, and they don't really, in a sense, activate or modulate the immune system. So they have a very specific target, either CGRP or its receptor. So we don't believe that these increase the risk or make people immunocompromised and increase the risk of them, contracting the virus or having a more severe outcome if they do contract the virus. So great question, but no, people who are on, these antibodies and they're doing well, I would encourage you to stay on them.
Thank you. We have another question around symptoms with COVID-19 and general experience of migraine. And so I've been seeing a lot of stuff about the loss of smell and taste as a pre-symptom of COVID-19 infection, in addition to headache. When should I start worrying about quarantining versus thinking it's just my usual prodrome?
Well, it's a good question, a very good question. This lack of smell and taste is something that we are learning about. But remember the other symptoms that go with this virus, which is fever. And, if you're worried, take your temperature. And everybody should have a thermometer, so you could take your temperature. And if it's over 100 degrees, then you might want to discuss it with your provider. Are you short of breath? Do you have a cough? All of these are symptoms of the COVID virus. And just isolated change in smell or taste that might happen as a prodrome for migraine, for example, may not be the COVID virus at all. So you'll have to look for these other symptoms that also could go along with it.
I agree with Dr. Digre, and I would add that typically a lack of smell or a lack of taste is not really characteristic of migraine at all. In fact, just the opposite. Patients will often they develop what we call hyperosmia, where they develop an increased sensitivity to odors, not a lack of the ability to smell. So if you have a headache and it's associated with one of the accompanying symptoms that Dr. Digre just talked about, like fever, cough, or shortness of breath, and you can't smell and or can't taste, I would be very concerned about that, because the lack of ability to taste or smell is not characteristic of migraine. It certainly doesn't persist as well. From what we're seeing, this lack of ability to taste and smell is a rather persistent symptom of this COVID-19. So if anybody has a very peculiar lack of taste or smell as a prodromal or as an attack-related feature, invariably that will be short-lived and will go away with the headache, and it won't persist. So if you have a lack of ability to taste or smell and a headache and any one of those other symptoms, I'd be concerned.
And then contact your provider.
Yes.
Absolutely.
Because they'll direct you to where you can get a test done.
We have another question about rescue meds. And so the question is, many of my rescue meds fall into the anti-inflammatory category. Are these still okay to use, even if I were to become infected?
That's a really good question too, and we don't really know the answer to that. There is some anecdotal evidence and thoughts that perhaps could be worsening with either ACEs, the angiotensin converting enzyme medications that we sometimes use, or NSAIDs like ibuprofen or naproxen or something like that. but it's not proven at all. And I would rather a person go ahead and treat right now and get the migraine under control until we have better data. We just don't, there are no clear data on this, that this is going to worsen the disease.
I would agree. And I would also say, you know, there really isn't good scientific data. There's anecdotal data that NSAIDs may have worsened the course in some patients, but really, we really have no idea, and there isn't overwhelming evidence at all. So I would be very cautious about having a patient who's been doing really well with NSAIDs, particularly as acute or rescue treatments for all the reasons we just talked about. I would also be very concerned about them stopping an ACE inhibitor like lisinopril or an angiotensin receptor blocker like candesartan or Atacand, when stopping those abruptly could have serious consequences, particularly if you have cardiovascular disease or hypertension, but even if you don't. And so you may have other diseases that get worse. Your headaches could spiral out of control because you've now suddenly withdrawn yourself from a preventive treatment. And there really is, and I read something today from the American Heart Association that actually explicitly says, do not stop those medications right now, because we do not have evidence that being on them increases the risk of a serious outcome from the infection. So I would agree with Dr. Digre. Don't stop those medicines, and if they're working for you, continue on with them for now until we know more.
Thank you. We have one last question that was submitted, and I think this is a really important question in a time of uncertainty. Where do I go for accurate information?
Well, I would say the CDC and the WHO probably has the most accurate information. And I know that we will post that on our website. I know there are already links on the AMF website to the CDC, but that is where I'm sending people for the most accurate information right now. And the American Migraine Foundation and the American Headache Society are really dedicated to try to help in every way we can to provide factual, accurate information. But those, I think, are two very trustworthy web sites to go to.
I would agree, and I would say that they are, you know, laser focused on this issue right now, and so they keep in a very up-to-date and timely way their websites, and so the information there, I think, is the most trustworthy. So I agree with Dr. Digre, the CDC and the WHO, and it's I agree with Dr. Digre as well that the American Migraine Foundation and American Headache Society are absolutely committed to this, because let's face it, we have 40 million people in this country with migraine, and many more with cluster headache and other disabling headache disorders. And we've got over 1 billion people on the planet who have migraine or other headache disorders. So there's a lot of people we're talking about here. So it's essential that we get them the right information, the most accurate information, and that we provide them with information that's going to help them in their ability to manage their disease at home and stay at home and minimize the risk that they're going to acquire this infection, transmit this infection, and they can be part of the solution of flattening this curve.
Thank you so much, Dr. Digre and Dr. Dodick. I really appreciate the time you've dedicated to us tonight and really ensuring that we understand COVID-19, especially as it relates to migraine and other headache disorders. What I will say to the community is we will be doing a recap article of this Facebook Live event, and we will be listing all of the resources that were mentioned here tonight and links to the CDC and the World Health Organization to ensure everybody has access to this information. And please stay in touch with AMF, get connected to our Facebook community, and we'll continue to push out these Facebook Live events during this time. Thank you.
Thank you.
Thanks so much.